Over the years, MS Teamworks has shared different perspectives on MS from patients, care partners, family members, and healthcare professionals. Guided by our mantra, I have MS, I have a team, I have a future, we are proud to share new messages of hope and inspiration with the MS community.
I have MS.
I'm on your team.
I have a future.
I'm Amy Perrin Ross, a neuroscience APN at University Medical Center in the western suburbs of Chicago. My role is to assist people living with MS to live their lives to the best of their abilities. I see people in clinic. I work with them in terms of disease-modifying therapies, diagnosis, symptom management, side effect management, and pretty much anything that has to do with day-to-day life with people with MS. How prevalent is cognitive impairment in people living with MS? That's a question that many of us who are involved in MS research and clinical activity are asking all the time. Good news is we have now a large group of international colleagues who focus specifically on cognition in MS, and many of these are neuropsychologists or psychiatrists from around the world. I think their current estimates is anywhere between 45 and 75% of people will experience cognitive dysfunction. Way back when, in the 80s, we used to tell people, oh, don't worry about MS. Cognition, you'll always have your clear thinking. It's just a disease of the lower extremities. Well, clearly we've done a 180 since then. We know that some people don't have much in the way of motor problems, and in fact may have quite a bit of cognitive problems. We also know that cognitive problems can start day one. It's not something that we only see very late, people who have had the disease 20, 30, 40 years. We can see it day one. And I think of a patient in my practice who presented to us because she was looking for disability. And we thought, well, that's quite unusual. She's 45 years old, and we weren't quite sure. She'd been a woman who worked in an accounting office for a number of years, and the patriarch of the family who owned this accounting company had died. His grandson took over and implemented a bunch of new computer programs. The woman who's my patient had a great deal of difficulty learning those computer programs. She could follow the directions, she could do what she needed to do right then and there, but by the next day she had to figure it all out again. Eventually she lost her job, became depressed with the loss of a job, and had difficulty organizing her thoughts and priorities to figure out what was what, and began to experience some other neurologic symptoms. So she came to us thinking maybe she'd had a stroke or something. And it turns out, actually, in looking at her and looking back, we examined her and found some other subtle things that she wasn't aware of. But in looking back, actually, cognitive problems were the first presenting symptom in this woman. So we have to be aware of that. We have to recognize that cognitive problems go from one end of the spectrum to the other. And many of my patients with MS are often very concerned about this. They're concerned about getting Alzheimer's and MS. They're concerned about it because they perhaps forget a name or miss an appointment or something of that nature. And I can do my best to reassure them that the kind of memory loss and forgetfulness and those kinds of things that we see in Alzheimer's is very different than what we see in MS. There are many, many different domains of cognitive function. There's attention, there's concentration, information processing, information storage and retrieval. The good news, if there is, for people with MS is that they usually only have deficits in one of the domains. So with some early neurocognitive evaluation, we can identify, our neuropsych colleagues can identify specifically which domain it is. And very often in people with MS, the domain is attention. I say to my patients, if you don't pay attention, the information doesn't get processed. I say, if I ask you about something you've read, that's visual information. It should be processed in the back portion of your brain. If I asked you about something that you heard, that's processed here in the temporal area. If you don't process it, it won't be there 2 hours or 4 hours or 8 days later for you to remember or pull out of the memory. It's got to be processed somewhere. So if I ask you what my name is, and you're all of a sudden, oh my gosh, you just said what your name was, and I know what it is, but I've forgotten. You haven't, there's not a problem with your memory. The issue is you haven't processed it. You were more worried about what else was going on, or what I was going to do to you or for you that day. So I tell them, usually it's one domain, and we identify what domain it is. And from there, we can work on strategies to strengthen the deficit in that domain. For example, if I have people who are very visual learners, but they have a problem in their occipital lobe, maybe what I need to do is focus on their auditory areas. Because if they're not processing visual information very well, maybe reading things out loud. For example, people say, well, I'm trying to read the instructions on this computer sheet or this, box for a recipe, and I'm just not getting it. I have to keep stopping and interrupting myself. I say, try reading it out loud. If they read it out loud and the damage that's done is done in the occipital lobe, if their auditory area is still intact, reading it out loud will trigger them, okay, I start with a measuring cup and then I get the water and then I do, the dry mix or whatever. Find out where their strengths are and maximize those to compensate for deficits that we can't identify. My patients are concerned about getting through their lives every day. They're concerned about the impact that cognition or cognitive difficulties may have on their quality of life. Are they able to maintain their role as a mom of 3 kids under the age of 5, or do they start to need some assistance in the home? Are they able to maintain their role as a part-time worker in a small dress boutique where they need to be on top of what the inventory is, with inventory coming and going all the time? Are they okay to manage their way from the suburbs where they live into the city on public transportation that they take every day but may require multiple changes from trains to buses or whatever? These are things that impact their quality of life, and these are the things that are quite concerning to them. Depending upon where they're at, most often they make a joke of, I'm getting so forgetful, I must be getting old, whatever. They're not so concerned about necessarily forgetting things as they are what is the impact of cognitive dysfunction on their activities of daily living, on their quality of life. Again, we see people who don't recognize some of their own deficits, but they know they're having difficulties, so they can't necessarily put 2 and 2 together, and that's one of the things that I try to help them see, how one piece of the puzzle fits in terms of the whole picture. I think we need to think about some of the things that impact cognitive function. First of all, do your best to live a healthy lifestyle. eat the appropriate foods, good nutrition, vitamins, minerals, healthy foods. We would prefer that our patients get their vitamins and minerals through food as opposed to supplements and things, but sometimes that's better than nothing. Getting enough rest. I think all of us can relate to what it's like to be jet lagged or incredibly fatigued. I know that happens to me. I don't process information as quickly as I normally would, and when I can't process it as quickly as normal, some of it goes off to the side of the road. I miss it because I just can't handle all the information that comes at me all the time. It's classic in people with MS. They have insomnia, they have some sleep difficulties, they may have sleep apnea. If they're not getting the appropriate rest and sleep, cognition is one of the first things to suffer. I mean, they talk about fatigue, but cognition really suffers. Some of the other things that they can do, attempt to keep their body temperature as reasonable as possible. Remember to hydrate. That's one of the things that people with MS notoriously do not do, is they don't hydrate enough. Hydrate, hydrate, hydrate. Dehydration leads to fatigue, leads to befuddled thinking, leads to forgetfulness, and something as simple as an extra glass of water a couple of times a day really makes a lot of difference. But people with MS don't like to do that because of potentially bladder issues. Exercise your mind. Do things that you enjoy. Some people enjoy crossword puzzles, some people like Sudoku, some people find word games challenging. I'm an old trivia fan, so I tend to watch reruns of the old shows from the 50s and 60s and try to figure out what the answers to some of those questions might have been. Why? That's mentally stimulating for me. Others like to do things like play chess or checkers or whatever. I have a good friend who always wants me to play Scrabble. I can't spell, I never have been able to. If you put me in a Scrabble's game, that would increase my anxiety and dramatically worsen my cognition. So don't be forced into something that's not you. Use what you think you can do, use what you enjoy to continually stimulate your mind. The main thing I want people to remember after watching this video is that cognitive problems come in all shapes and sizes. Cognitive problems happen to all of us, not just people with MS. There's about a 45 to 75% incidence of cognitive problems in people with MS. The good news is, particularly early on, generally it's not global cognitive memory loss. It's one of the subsets or one of the multiple domains of cognitive function. For example, information processing, attention, and concentration. We can identify where the problem originates. There's some easy, quick kind of things that people can do on their own to practice day to day, and that really will make life much more livable despite whatever cognitive limitations there might be.